Welcome to Health Focus, where we focus on your health. All of us here in the studio want to focus on fostering health through education and dialogue. I'm your host, Dr. Scott Anderson, and it's my pleasure to introduce our inaugural show on Juvenile Arthritis Awareness Month. Most of us have heard of arthritis, which means inflammation of the joints. In fact, the American College of Rheumatology recently wrote that arthritis is among the most common and expensive causes of disability. Indeed, 1 in 4 adults are currently diagnosed with arthritis. That translates into 54 million Americans, and we're talking healthcare costs of $81 billion annually. 32 million arthritis sufferers are between the ages of 18 and 64 years. In the prime of their lives, those people are treated by rheumatologists such as myself who specialize in management of arthritis in adults. But let's not forget about younger people with juvenile or what might be called pediatric arthritis. Pediatric arthritis is an umbrella term for conditions that may cause joint damage or inflammation in kids roughly under the age of 16. Believe it or not, 300,000 youths are affected by pediatric arthritis in the United States. Careful assessment and treatment can help to prevent disabling complications. There is a subspecialty of rheumatology that is devoted to this, and it's called pediatric rheumatology. Rheumatologists typically complete internal medicine residency training and then additional training in rheumatology. Pediatric rheumatologists have additional subspecialty training in the diagnosis and treatment of arthritis in children. Treatments may include physical education, physical therapy, and a broad range of medications. In fact, there are a broad number of types of arthritis, ranging from lupus to soft tissue pain to inflammation of the muscle. New treatments are constantly evolving. Today, we are fortunate to have with us a distinguished guest, the Executive Director of the Arthritis Foundation, Ms. Deborah Jackson. Director Jackson will convey her expertise regarding Juvenile Arthritis Awareness Month and what it means to our community. Executive Director Jackson, it certainly is my pleasure to welcome you to this inaugural show of Health Focus.
Thank you. Thank you.
I'd like to start, if I may, by asking you some questions which I think the public would be interested in knowing about. Obviously, I have my perspective as a rheumatologist who treats people, but you have a perspective too from your experience as executive director of a very important organization. If you would, could you kindly tell us a little bit about the Arthritis Foundation, how long the organization has been active in the community, and how you came to be so involved in it at such a high level?
Okay. Well, first of all, thank you so much for allowing me to be here on your inaugural show. I'm very happy to represent the Arthritis Foundation here. The Arthritis Foundation has been around since 1948. We lead the fight for people with arthritis through life-changing information and resources. We advocate on behalf of people at state and federal levels. And also we focus on 5 pillars. Advocacy, which is, eliminating barriers to care. Scientific discovery, we fund a lot of cutting-edge research. Help and support, so we provide trusted information and resources to people with arthritis. And our juvenile arthritis program, which we're very proud of, and we'll talk a little bit more about that later. And then our community and connections, which we do through our fundraisers and special events.
Now, the Arthritis Foundation, of course, is well recognized, but there's also a professional organization for physicians who treat arthritis called the American College of Rheumatology. Mm-hmm. I understand the Arthritis Foundation used to be affiliated with the ACR and then became separate. Can you sort of explain that relationship?
Well, back when the Arthritis Foundation was first founded, it was part of the American College of Rheumatology back in 1948, and it spun off as its own organization to focus primarily on patient care and fundraising for research.
So the ACR really is an organization of physicians that also educates patients. You're perhaps a bit more patient-oriented or
right, where ACR
public.
is more geared towards the professional education.
Okay, and Director Jackson, let's turn to a discussion of Juvenile Arthritis Awareness Month. Is this a local event? Is it a national event? And does it have any international activities associated with it? And how long has it been in existence?
Well, Juvenile Arthritis Awareness Month is a national event, and as part of that, we've been doing it probably at least 20 years. And as part of that, we have our National JA Conference that is held in July, which is the month. And also locally, we do our Camp Milagros, which is a camp for kids ages 8 through 13 that the children come and they, for the first time, actually get an opportunity to see other kids that are going through what they're going through.
And where is Camp Milagros?
Camp Milagros is held at the Taylor Family Foundation campsite in Livermore.
I see. If individuals or parents or persons with juvenile arthritis are interested in learning about that, can they contact the Arthritis Foundation?
Absolutely. They can contact us at our local office in San Francisco, 415-356-1230. Or they can go on our website, www.arthritis.org, and key in Kids Get Arthritis too.
And about what ages would be eligible for this particular activity?
For Camp Milagros, it's ages 8 through 13.
Very good. And I also understand that there's a National Juvenile Arthritis Conference. Can you tell us a little bit about that and where it occurs, when it occurs?
Right. Well, traditionally we've had it one conference. It has grown to the point where last year we separated and had 2 conferences, one on each end of the coast. This year we are having July 13th through the 16th. It's going to be in Houston, Texas. And then in August 13th through the 15th, it's going to be in Indianapolis. The JA conference is life-changing for people that attend. It's an opportunity for parents to get together with other parents, children to learn and bond with other kids. Conference workshops span every topic you can imagine, from school, relationships, how to deal with your physicians and insurance. So the gamut is covered in terms of what the conference covers, in addition to having an opportunity for camaraderie among the kids and the parents.
Dr. Jackson, you mentioned communication issues, and as I'm listening to you describe the National Juvenile Arthritis Conference, I'm thinking that as a rheumatologist, communication is so important to the treatment of arthritis in adults, and often just getting communication from the doctor to the patient, from the patient to the doctor, is difficult enough. When we're talking about children who may also be at a level where they depend upon their parents to intercede on their behalf, it must be even more complicated.
Absolutely. Well, and that's where we partner with the pediatric rheumatologists to make sure that they have information that they can provide to the children, and then making sure that they have our information that they can pass on to the families and have us as a resource, so that we're able to provide some of that information, answer questions that maybe they're not comfortable with or they don't really understand. We have in the spring, we have what's called a JA Family Education Day. And at that event, we have a lot of newly diagnosed parents and children that come. And this is where we have physicians that come and they do workshops. And the parents have an opportunity, to find out, because this is usually their first experience and exposure to the Arthritis Foundation and other parents and other children with a similar disease. And so they have an opportunity to learn that they're not alone. They get to ask questions of the physicians right there. It's a small group, generally no more than 30 or 40 parents and families and children. And we have separate programs for the kids, where we have workshops and crafts for them. But for the parents, it's more an opportunity for them to really learn how to communicate, with the physician and with their children.
Yes, I think communication is the key to any really successful therapeutic alliance. And of course, In Northern California, we also have a lot of linguistic and cultural diversity, so you also have to communicate in a manner that is intelligible and meaningful for the family, right?
Exactly, exactly. And that's where we come in. You know, we work closely with UCSF and Stanford, and Kaiser as well, where they have social workers that I know Stanford and UCSF has social workers specifically to the pediatric rheumatology clinics. And so they work with those families and are able to provide any kind of communication, diversity issues that may come up, language issues. They can help with that.
And pediatric rheumatology, of course, is a subspecialty, so you don't generally find pediatric rheumatologists very much in the community. But as you mentioned, the University of California at San Francisco has an excellent program in pediatric rheumatology.
Exactly.
Under Dr. Van Shaven. And Stanford, of course, I believe also has a good program. The University of California Davis School of Medicine has a strong rheumatology division, which I'm privileged to be a part of. We rely on our pediatrician colleagues to assist us in cases where there might be some pediatric illness as well. Let me also turn to the issue of just the complexity of dealing with insurance and the bureaucracy of modern medical care. That's another issue that must be overwhelming to parents of kids with juvenile arthritis.
Exactly, which is why, again, we strongly encourage parents to work with their social workers to help them overcome some of those issues. We're lucky, in fact, that we're in the Northern California area, the Bay Area specifically, where there are so many resources available to families, and that they're not necessarily having to go through this by themselves, and they can get a lot of their questions answered.
As an example, you might wish to comment on this, but there are some forms of rheumatological illness or arthritis in children that can actually affect the eyes, causing inflammation of the eyes, or affect the skin, causing inflammation of the skin. And so a pediatric rheumatologist may need to interact with, for example, an ophthalmologist or dermatologist, and then you might have secondary issues such as depression or a sense of being stigmatized or socially isolated.
Right.
Can the Arthritis Foundation help families in trying to negotiate the complexity of the referral process and also dealing not just with the pediatric rheumatologist but primary care providers?
What we can do is, while we don't necessarily have those type of services available, we can connect families with other families who have gone through it and can help guide them in the direction that they need to.
Very good. And also, Director Jackson, I understand that there's something called Team Retreat, which the Arthritis Foundation is involved with this fall. Could you kindly tell us a little bit about that?
Sure. So Teen Retreat actually came out of a few years ago. It's actually a nationally awarded program. We're very proud of it. Started here in our San Francisco area. And what it is we discovered that we had children that were aging out of our Camp Milagros, which is ages 13, and then we didn't really have anything else for them once they got out of camp. And the children really wanted to have an opportunity because they form these bonds with other kids. And so we established the Teen Retreat, which is a weekend retreat at the Marin Headlands, actually it's in Sausalito, and it's in October. And it's an opportunity where we kind of take the education a little bit further. Where camp is, we do provide some education for the kids. It's more fun opportunity for them to bond with other kids. We use the Teen Retreat as an opportunity to have the teens become more aware of managing their own disease. We have workshops on how to deal with going to college, how to deal with school, how to deal with talking to your doctor without your parent, being responsible for taking your own medication, understanding your insurance. So we bring in speakers during that weekend to talk about life-changing situations.
I think that's so important to remember that, especially as you get into the teenage years, there's a sense of being an individual and not just being a kid that's important. And I know that adolescents, they want to feel independent and that they're in control of their own destiny, and they also have all the problems that other kids have.
Exactly.
Like getting grades, relationships, and so forth.
Exactly.
So I think that's very important. And Sausalito is hardly a hardship post if you have to go and attend a meeting.
Exactly.
Beautiful place. Do you have any advice, Director Jackson, for our viewers who may have children or relatives with pediatric arthritic conditions. How can the family members help out kids who are struggling through this?
Well, since I'm not a medical professional, I hesitate to give advice, but what I would say is if there's families that are going through this, please feel free to give us a call, the Arthritis Foundation, or go to our website, Kids Get Arthritis Too, at www.arthritis.org. There's a wealth of information on there. We also have what we call a power pack for kids. So if a family member goes onto our website, they can sign up and get that power pack, which is chock full of information. It's a backpack. We have two types, one for adolescents and one for teens. And in that is information. There's a book in there about arthritis, how to talk with your parents, how to talk with your doctor, in addition to additional information that they can help locally.
I understand that the Arthritis Foundation also does sponsor ongoing research.
Exactly, we do. In our local area, we underwrite fellows, which I think you mentioned earlier is, the additional training that rheumatologists have to take if they're going to do a subset of rheumatology. So we help underwrite those last 2 years for fellows. We have them at Stanford and at UCSF. And so it really does make a difference because we're trying to keep that pipeline of rheumatologists open. And you may or may not be aware, you probably more so than anyone, the lack of rheumatologists that are in the country, particularly pediatric rheumatologists. There are like 300 pediatric rheumatologists throughout the country for the 300,000 children that are affected. So by us helping to underwrite some of that fellowship program funding, it helps keep that pipeline open.
The shortage of rheumatologists, in fact, is a constant area of concern for professional organizations of rheumatologists because there is this demographic group, the baby boomers, who are getting older and who are going to retire shortly, and the number of new rheumatologists being trained is not sufficient to really replace them. We see this in our own training program at the University of California Davis School of Medicine, and we always are looking for really first-rate fellows. One of the things that many people may not appreciate is that a fellow is a fully trained and licensed physician, typically in this case in internal medicine, perhaps in pediatrics, who is actually seeking even more advanced training. And if an individual is hospitalized, for example, very often the first person to really evaluate that person's rheumatic condition will be a fellow, who in turn reports to an attending physician, such as myself, who might be on call. But fellows are critical to the provision of health care, so that's very important work that you're doing there, Director Jackson. I think that the public really deserves to know about that. If the public wants to know more about Juvenile Arthritis Awareness Month, you mentioned some of the resources available to them. Is there a detailed website that outlines some of these activities that we've discussed?
Absolutely. It's our arthritis.org website, and you can key in Kids Get Arthritis Too. It's actually at the top of the website when you first click on arthritis.org. And as I said earlier, there's a wealth of information for parents and children available on that website.
And do you have the feeling that the word about juvenile arthritis as an important health issue is getting out to the public in a sufficient way to really be, rising to the level of the public's awareness of other conditions?
I wish I could say yes. Unfortunately, people have there's this myth that arthritis is only for people that are older. People just do not realize the effect that it does have on children. There are so many children that are affected by arthritis. And treatments have come so far now that outwardly, the child doesn't necessarily look like they're affected until they may have a flare. And so we're here to try to make awareness that kids do get arthritis too, and it is much more devastating than, say, an older person with more of the osteoarthritis, which is the joint-related, where, as you know, pediatric rheumatologies can affect the organs and the internal. So it's, I think, much more devastating to have pediatric rheumatologists than osteoarthritis.
I think that's well said, and also I think that we have to remember that if we treat young people successfully for arthritis, we're going to be really helping them to stay on a long-term trajectory of being members of the community who are employed, who can work, who can provide for themselves and for their families. And that's very important. Conversely, if we don't adequately treat juvenile arthritis, we run the risk of having a population of adults with significant impairments. So I suppose one could say that it's a matter of being penny wise and pound foolish if we don't invest in research, in training rheumatologists, training pediatric rheumatologists, and really aggressively treating pediatric rheumatology.
Exactly, which is why we do, in order to fund this research and the fellows and the camps, we do have our community education and community fundraisers that we do. We do our arthritis walk in the spring, and we also will be starting a Jingle Bell Run, which is a run walk in December. And so these are some of the ways that we help fund these programs.
Now, as Executive Director in Northern California, do you also network with other Arthritis Foundation groups, for example, in Southern California?
Absolutely. We have close relationships with our other offices throughout the country. In fact, I work every week. I have a call with my other counterparts from the East Coast as well as the Midwest. So we partner and we share ideas and share concerns and just kind of share, figure out what's working and what's not. And so we do have close relationships with them.
We mentioned the issue of culture and how different cultural groups may have different specific needs. I think one of the issues in Northern California that would be very common would be trying to diagnose and treat arthritic conditions in Spanish-speaking individuals, members of the Hispanic community. We know, for example, that there's a very high incidence, unfortunately, of some conditions such as systemic lupus in Hispanic patients.
Mm-hmm.
And I think we mentioned culturally sensitive and also linguistically sensitive treatment modalities. I think having an adequate interpreter is very important. Wouldn't you agree?
Absolutely, absolutely. While we aren't able to do a lot of that in our office, that is, again, where we work closely with our pediatric rheumatologists at the hospital settings and the clinics to make sure that there is adequate information in particularly Spanish.
And also, let's recognize that there are so many other groups as well who may be in a similar situation. There's a large immigrant community from Asia, for example. There may be slightly different cultural and medical needs among Native Americans, African Americans, and other groups. So
Mm-hmm.
I think there's an argument to be made for having a group of rheumatologists and primary care providers who come from diverse backgrounds, perhaps who bring unique skills and other abilities to this. Do you have any suggestions in closing, Director Jackson, as to how our viewers might do more to support this cause and to get involved in Juvenile Arthritis Awareness Month and with the Arthritis Foundation in general?
Well, absolutely. Again, they can contact our office in San Francisco, 415-356-1230. We have ongoing opportunities, volunteer opportunities. We're looking for volunteers at our camp coming up. We'll be working on our next fundraiser in December, our Jingle Bell Run. We're always looking for volunteers. We're looking for people that want to start a team to help us raise funds for these events. So please feel free to reach out to us, and we're happy to help in any way that we can.
For example, getting involved in a team, would that involve sponsoring other people who participate in these events or bringing people in?
All of the above. If they want to start a team, we can help them start a team. We can help show them how to do specific activities that can help them meet their fundraising goals. If they want to contribute to a team, we can help set them up with that. If they just want to make a general donation, we can certainly help them do that as well.
Do you feel that you're getting the support that you need from the medical community in getting the word out about these activities, either in rheumatology or in primary care?
We're working very closely. We have a complete campaign of healthcare provider outreach that we're working on, where we're actually going out. We've always had a very close relationship with rheumatologists in general, but we're continually to outreach and make sure that they know that we're available.
And thank you so much for joining us in this inaugural broadcast of Health Focus. It certainly has been my pleasure, both as a rheumatologist and also as a parent and a member of the community, to focus on juvenile arthritis. I respect the enormous effort that the Arthritis Foundation is making to increase public awareness regarding juvenile arthritis, and I hope we can continue this conversation in the future. Thank you to our viewers for joining us for this. We hope we will have additional health-focused shows that deal with other healthcare issues. I'd like to thank all of our staff and supporters. Remember that on Health Focus, we focus on your health. So have a great summer and stay healthy. Thank you. Thank you so much for being with us.
Yeah, thank you.